suffer from lower back pain? Poor lifestyle choices like smoking, lack of regular exercise, bad food habits, incorrect posture, and many others may be to blame. The pain you feel in your back is most oftentimes caused by having what's known as a slip disc. A slip disc is basically a bulge on one of the discs that are between the tiny vertebrae in your back. Poor lifestyle choices and back trauma are the primary reasons for this condition. When the disc bulges out far enough to press on the nerve, it causes pain, sometimes more severe than others. Pain radiating to the hips, back of the knee, heel, and toes are all pretty common. If you're suffering from lower back pain, the bottom line is that you just cannot neglect it any longer. Good chiropractic care will help you finally find the relief you need and live the pain-free life you deserve. We have years of experience and thousands of satisfied patients. We would love to reduce your pain and have you be our next happy patient. Contact us today.
So we discussed that about 2 months ago you started experiencing pain in your lower back, which radiates down to your left leg stronger than to the right leg, and travels below the knee but doesn't touch your toes, right?
No, it doesn't touch my toes.
Okay. And do you remember experiencing any accidents, like falling or?
I'm very active, so
like going to the gym?
Like going to the snow.
Uh-huh.
I went to the snow a couple days when it started, when I noticed it, but it went away.
Okay, so you mentioned me over the phone that you
Yeah.
fell down. Were you tubing or something?
Yeah, we were tubbing and
Tubbing,
I just slipped. But
So when you slipped, you fell on your buttocks?
On my butt, yeah.
Okay, did you hit your head as well?
No.
No? Okay, so was it painful when you...
It was, but not that day. I remember
Okay.
the next day I was sore, but it went away. And then, that's the only thing I could think about.
Okay. Yeah, most likely when you fell down, your pelvis shifted.
Yeah.
And when shifted, you felt a little bit pain and then it went away, but in reality, it stayed unbalanced.
Yeah.
And now it's kind of hunting it down because
Yeah.
that's an injury.
Yeah.
And that you probably most likely didn't address
And
properly.
I'm very active. Like,
Okay.
I play with my nephews. I play with the dogs. I'm a very rude, I'm very
Okay.
hands-on. I'm very, active.
And now you feel like this is a limiting
man,
factor?
Yes.
Okay. All right, so let me just write. What's the level of pain in your low back, 1 to 10? How would you rate
Right
it?
now,
Yeah.
it's a 7.
7?
Yeah.
And does it wake you up at night?
Yeah.
Okay. Have you been taking any pain medications to...
I was taking Advil, but I don't even take it anymore. It doesn't make a
Stop
difference.
working?
Yeah. And it just hurts my stomach.
Stop working. Okay, go ahead, please put your back to the side so I can see what's going on with you. And then we'll go from there. Do you have any neck pain?
No.
Oh, just low back.
Just low back. It doesn't shoot up all the way up here.
Okay.
But
Well, we're gonna look at your spine anyway. Just lean back.
okay.
Just relax. Does it hurt to sit?
Yeah.
Okay. Is it worse when you're sitting or when you're standing?
It's worse when I'm sitting.
Okay. So Rajamo's on the right side of your neck. Does it hurt here?
No, there you
Right
go.
there, middle
Yeah.
back. Yeah. Any pain
There
around
you
here?
go, yeah.
Yeah?
Yeah.
Right. Okay, so I'm gonna move it to the side. I'm gonna move you to the left and to the right, so if it hurts, just bear with me. Bend forward, please. Back. Forward. Okay. Okay. Stand up, please. Face the window. March in place. Okay, stop. Foot is out. Have a seat, please. Yep. Okay, so this is basically, assuming it's you. So if whatever happened, you slip, and when you fell down, most likely you didn't fall down on your tailbone, most likely you probably fell down on one of the sides. And this is the pelvic region, and one of the legs, one leg attached here, one leg is attached here. So when that happened, most likely you fell on the left side, because this is where the problem is. And so your pelvis shifted like this. If you look at your posture, you see the left side is about 1.25 inches lower than the right side. And then so one of your legs becomes longer, one becomes shorter. And so you see these nerves coming out of the sacrum, they go down your leg. So what happens is that every time you sit, they put more pressure on these nerves, and the result, it starts shooting down your leg. So what we need to do is basically realign you here, and then the right side of your lumbar spine, which is right here, is also locked up. And so we need to free it up by adjusting it. And then the middle back, when I touch you here, was a lot of pain. And there is a lot of muscle inflammation here, so when I touch, like you touch the muscle, then you feel like there's a bump. And then your neck, the right side of your neck doesn't move. Because when this misaligned here, because this is like a foundation of the spine, the rest of the spine is going to compensate. So what I'm going to do, I'm going to adjust you here, 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 and on the right side. And then we'll see how you do after the first adjustment, what's the feeling. And then based on that, I'll be able to give a recommendation how many more sessions you need. Okay? Does it make any sense?
Yeah, it makes sense.
Before we move forward, do you have any questions?
No. I just, well, yeah. I've noticed that it hurts, like right here. Oh, I'm not sure that.
Yeah, it's right there. It's this region. What you're pointing is around L4, L5. Yeah. L4 is more.
I have a ball there too. I have a bump there too.
Yeah, it's what the bumps signify. Basically, it's an inflammation, because when there is an inflammation, there's accumulation of the liquid, and it starts bulging the muscles out. And basically, inflammation is a good thing, because it's trying to protect the joint, so you don't kind of like create further injury, because if it's not going to hurt, then you're going to start doing more things and damaging more. So when it creates an inflammation, it's basically kind of like a protective mechanism. When you hurt, you're not going to do worse to it. Make sense? Yeah. That's basically body's defense mechanism to protect the vital parts of the body. Any other questions? That's it. Okay. So what I'm going to do, I'm going to set you up for the hit and stim. And then I'm gonna adjust, and then after that you're gonna see my massage therapist, and she's gonna do the rest, and then we'll talk more once everything is done. Okay?
Alright, I hope you fix me. I'm a very active person.
We'll do the best we can. Okay, so what I'm gonna do, I'm gonna adjust your middle back first. Okay? So stay down, please. Keep your head down. Take a deep breath in. Out. Okay, breath in.
Wait, there's some paper in my mouth.
Okay, it's okay. Take your time. Okay. Put your hands down. Take a deep breath in. Out. Okay. Breath in. Out. Okay. Now go on your side. Face me, please, like you sleep on your side. Take your time.
Thanks, Dr. B.
Take care. Okay. Keep this leg straight, please. This goes like this. Okay. So you're gonna have a feeling that they're gonna be falling off the table, so just relax, okay? You're not gonna fall, okay? Relax the shoulder. Okay, sit up, please. You feel that move? Okay, put your feet down, please. Lean back. Okay, relax. Okay, now go on this side, face me, legs over there, hand over here. Alright, keep this leg straight, please. Okay. Relax your shoulder, relax your shoulder. You feel that move?
Yeah.
Okay, stand up. Did you say the worst position was when you were sitting?
Yeah.
Okay, how does it feel now?
It feels a little better on this
Okay.
side, but I
Okay.
still feel
Okay,
this side, yeah.
that's fine. You know, it's not gonna go away right away,
Yeah.
but stand on your feet. Do you feel a little bit more balanced?
Yeah.
Yeah?
Yeah.
Okay. So I'm gonna send you to my massage therapist right now, and she's gonna do the rest of the
Okay.
magic, okay?